Okay. We still have a couple of maybe like 1 minute until we start at 12:30, but wanted to get everyone into our meeting. Okay, we have Joe is coming on. Okay, all right. All right. So, okay. So if you see that little blue button pop up and I don't, you're welcome to add folks to the meeting as they come in. Okay. All right. Okay. So I think it is 12:30. So let's get started. I want to welcome everyone to today's webinar. Today we're going to hear from Rachel Petersen of Frontline Medical Group. Before we start, I want to thank all of you for being here. This is a really important topic to our members and our larger community. This meeting is open to both members of the Alliance and non-members of the Alliance. We really believe that supporting you and your business supports the entire industry, and we want an industry that works well for the people of Massachusetts and everyone can receive care in the setting of their choice. Our mission is to offer programs and services that help you meet the needs of your patients and clients in our world, but where they want to be served. And often that's an appropriate setting at home. Okay. So we believe in being responsive to what your needs are. And we heard that this is definitely a topic that is near and dear to your heart right now. So Rachel, if you would like to introduce yourself. I'll just add a couple of housekeeping items. I'm going to keep everybody on mute because we have about 26 people on the line. And it just makes it a little bit easier from background noise. If at any point you do have a question, throw it in the chat. I'll make sure Rachel or one of her team members is able to address it. If not now, then after the meeting. It is recorded as well if you want to share the call with other people on your team. All right, so that's about it. Rachel, take it away.
Okay, thank you. Thanks, Leslie. So my name is Rachel Petersen, and thank you for everyone for joining us today. I am very excited to present this topic. It's been a real learning experience for me to dive into these the elder care workforce projections and finding some creative ways to recruit and retain your staff. So when I started researching this topic, is everyone seeing the second slide here? I just want to make sure I'm on the right screen here, the 2030 problem.
So actually, it looks like you haven't launched the presentation. We can see all of the ones on the left and the title screen.
Okay. Okay. Sorry about that. Let me go to the right slide. Okay. Are you seeing the 2030? Okay, perfect.
Thank you.
Okay, great. So when I started researching this topic for the presentation, one of the first things I found was this 2002 study called the 2030 problem. And, it really hit the nail on the head as far as, we know that this, our elderly population is on the rise. Are we going to have, sufficient resources and an effective system in place to meet their needs? And, so I just found that really fascinating. And that's where I started on this road of really having a hard look at the population numbers and how it's going to affect elder care. To give you a little perspective, by 2030, 1 in 5 Americans will be 65 or older. And by 2060, that number is going to jump to 1 in 4. So that really does put a strain on our resources, because if you think about it, when we have, such a large portion of our population needing care, our portion of our population available to provide that care has shrunk significantly. So that's really where, this 2030 problem comes into play. That's where it really puts a strain on our resources. So we're trying to come up with some creative ways to deal with the staffing issues and retention and recruiting with these numbers in mind. So to give you a little more perspective on the population situation, this is the census statistics from 2022. And if you look at New England, you'll see, we're already pretty much at 1 in 5 in Maine, Vermont, and New Hampshire. So the 2030 problem is here for those states. Mass, Rhode Island, Connecticut, New York. I mean, we're in that 18 to 19% range, which is closing in on 1 in 5. So we're not far from there. This chart here helps as well, because now you have some historical perspective. So in 1950, it was 8% of our population was 65 or older. And that's now we've already doubled that, more than doubled that in 2024 now. So we're right around, well, I guess, yeah, we're right around the 19%, I would say, as of today nationwide. And in 2030, we've got that, it's going to be a solid 1 in 4. So, that's really shows you the trajectory here of, we've got all these people that need care, and at the same time, it's reducing our pool of people who are available to provide that care. So that's the problem. But it helps to know, the fine details, so that you can then get into, okay, how do we fix this? How do we deal with it? So we now, as a staffing agency, we're focused on nurses, CNAs, LPNs. So a lot of our data is based on, looking at numbers relating to those areas. But we think that, it's fairly applicable to any like a home care agency who's providing home health care, with CNAs, PCAs, therapists, whatever your staffing model is. It seems to be the same issues are facing, obviously, any direct patient care workers or agencies. So we took a look at these numbers as far as, nursing homes who are facing moderate or high, staffing shortages, and it's pretty much everybody. We get 2% fully staffed, but the vast majority are either moderate or high levels of staff shortages. So, I think that we're seeing the effects of, that the problem with the, sorry about that. I'm really sorry. And there's also, the difficulty of hiring staff. 98% of nursing homes are saying they're just having a hard time even hiring staff. And 61% are saying they're even having to limit new admissions, which therein lies the problem. If you're not able to take in those new patients because you don't have the staff to care for them, you're losing that income. And at the same time, when you don't have your staff, when you're paying your staff overtime and you're hiring temp agencies to fill in the void, you're basically canceling out, you're increasing your expenses and you're decreasing your income. And then, which is where a lot of these nursing homes are landing, is that now you're operating at a loss. So we have 59% operating at a loss. And that's certainly why, the staffing is such a key element to developing a business and remaining profitable. So I'm just wondering if, if others are, here are having, these situations in your home health agencies. We'd love to hear your feedback and just find out where you are, if you're experiencing these kind of issues. And I'm assuming, staffing is an issue for everybody right now. I also wanted to include this slide because it gives you an overview of, this is a very recent survey, from earlier this year, just on the status of employee mental health in 2024. I thought it was really interesting, and I wanted to include it here because, this is just, general employees, not direct patient care employees, who I think are, subject to even more stress and more burnout, because of their jobs are just very hard jobs. So if you look at, 44% of just, your regular office person feeling burnt out, we can only imagine, how direct patient care staff are feeling. So I just thought that was an interesting survey. I wanted to include it. And here's another number that's a little bit concerning is, you've got from the American Hospital Association's healthcare workforce scan done earlier this year. There's 800,000 registered nurses who are saying, they're planning on leaving the workforce by 2027. And again, that's either stress, burnout, or they're just aging out because they're, reaching retirement age. And that number, considering, again, you have that smaller pool of available workforce, how are we going to replace those nurses? And we're going to have a need for even more nurses. So, and then we also wanted to look at, the non-economic costs of turnover. Any direct patient care staff, when you lose them, obviously it's going to cost you money in a variety of ways. Hiring temp help, overtime for your existing employees. So you've got those economic costs, but then the non-economic costs are obviously, an unfortunate reality is, you lose the level of patient care that you really need to ensure like good health outcomes. In this study, and not that I really understand this math, it's very confusing to me, but obviously what it says is, when you lose staff and your turnover is high, you're going to see increased medical errors. And of course, that's going to, affect patients, affect their families, affect their health outcomes. And then obviously that has an economic toll as well. So nurse turnover, and I think you can apply this to any direct patient care staff. When you have this turnover, you're definitely hitting a significant, amount of loss from, just all the activities it takes to replace those nurses, to have the nurses or have the staff in place for overtime, and temporary staff. So it's key to come up with good ways to keep nurses and direct patient care staff in their positions as much as possible. So those are kind of the bad news. That was all the bad news. Now we're getting on to the good news. So does anybody have any questions about any of the statistics or information so far? No? Okay. Please feel free to jump in if you do. So I think, if we're able to examine all these root causes of, turnover and, our population demographics, we could then diagnose and heal ourselves, like the whole healthcare industry. Like we have this capability. And obviously there are some really smart people in the healthcare industry. So I'm assuming this is a very, we can meet this challenge here. I think, any problem is just acknowledging it, and knowing what you're dealing with. And then once you know what you're dealing with, you can tackle it that way. So that's where I feel like we're at. We know we have this problem. We know what the numbers are. We're seeing the data. And now we can come up with some good ways to fix the problem. So I looked at some other studies, and this was really interesting. This McKinsey and Company Frontline Workforce Survey from 2022 went through a bunch of reasons why nurses stay in their direct patient care roles. And the top reason is meaningful work. And I think that that's a really, interesting reason. I think that anybody would want to stay in a job if they feel like they're doing anything meaningful, and in this positive and engaging work environment. Feeling healthy and safe, feeling valued by a manager, recognition, a manageable workload, work-life balance. All of these factors ranked above compensation, which I thought was absolutely, amazing. So it's not all about money. It's really about, having like a very good work environment. So that's, I think, where the focus, if we can focus on that, we can definitely focus on or achieve our goals of recruiting and retaining our staff. This is the actual study, and I wanted to include it here. We don't have to obviously go through all this because I just picked out the main points in the previous slide, but I just wanted to include it in case this is made available and you wanted it, for your own information. And now another thing I looked at was the American Hospital Association's retention models and initiatives. Hospitals are coming up with a lot of creative ways to deal with their staffing shortages. Team-based care I thought was really interesting. Flexible resource pools, internal staffing agencies, gig shifts, and virtual nursing. So all of those I found intriguing, and I thought, if hospitals are doing this, you could probably apply this to other areas of healthcare, and just looking at like what works for them, and trying these types of things, I'm sure would be, beneficial. Especially if they're the guinea pigs and they're seeing that something's working, and if you use your network if you have friends working in hospitals who have experience in these things, it would certainly be worth asking them, like, what's working? What are you doing? So I wanted to just cover this. So they do have a multi-pronged approach that they outline, the American Hospital Association's workforce scan multi-pronged approach. So they're working on collaborative efforts with government agencies, partnering with community colleges, reconfiguring clinical training, engaging with teenagers to spark an interest in healthcare, upskilling through one-on-one coaching, mentoring, and educational benefits. That one I think is really worth having a good look at because, not only do you get the benefit of, improving your staff's skills, but then the cross training when you have shortages in one area, that could be a huge factor with retaining and keeping this pressure off your existing staff. And then nurse residency programs also, because one thing I've heard is from Raina, the owner of Frontline, is, a lot of direct patient care staff don't feel that they get adequate training to perform so they're confident in their day-to-day activities. So having these residency programs would really give people the confidence that they need, and obviously that goes to health outcomes for patients as well. So now we're getting on to specific recruitment practices that we wanted to lay out for you guys. You may already be doing some of these, or some of these may be new. Hopefully we're giving you some good ideas. Obviously, partnering with any community college is a great thing, especially now where Mass has the, I forget the name of it, but now there's a new program in place where basically people can go to community college for free in Massachusetts. So that's huge. So there might be, a huge influx of people trying to get their LPN or at community colleges. So certainly that's that's, if I were working at a home care agency looking to recruit staff, that's the first place I would start if it were me. And the colleges also use a job board called handshake.com. So if you're not familiar with that, I would highly suggest using that because it's free. And you can make your own account on there, just like Indeed. And it's very easy to use. It's really great. You make your account, you can post your jobs on there, and it's totally free. And then career events, obviously colleges, community colleges, Mass Hire, they're always having career events. You can even do online career events through, a variety of sources. So I would certainly, focus on events too, and even host your own events. If you have a office location somewhere and wanted to host a career event, that's certainly something anybody could do. And then as far as recruiting, you could, by implementing mentorships and cross-training initiatives, you can, that's more like in-house recruiting where you're kind of upskilling your existing staff. So that's certainly something that is good to consider if you can implement a program like that. And then, when you need to fill in the gaps, you can partner with a high quality, reliable temp agency or a staffing agency. We do temporary or recruiting, obviously. So that's, obviously an option when you're trying to fill those gaps. And then some of the recruiting initiatives that we are working on, or let me back up a little bit. Does anybody have any questions about the suggestions that we made on the previous screen? Okay. Oops, sorry. Okay, so some of the things that we're working on is the CNA certification reimbursement, which I believe is now also available through the state. I think the state has a program for this as well. But that's something that, is great if you can offer some free certification to CNAs. We are offering one-on-one clinical skills training to our staff, which again helps them feel more confident in their abilities and is great for patient outcomes. And then we offer CNA to LPN transition support. So a CNA that wants to become an LPN, we have resources for them in that regard. And then CNA internships for existing nursing students. We have housing resources. So if we are recruiting somebody from out of state, we can connect them with people who have the landlords who have apartments for rent, which is huge because Massachusetts obviously has such a shortage of housing, and that's just a major roadblock for people. And mileage reimbursement, something we do for our staff. And then we are developing strategic out-of-state recruiting and also international recruitment. So those are some things that we are working on now to increase our staff, our recruiting and our temp staff available to, our clients. So some turnover reduction practices to consider. If you don't currently have a mission statement, it would be, a good idea to try to come up with your mission statement and make sure that your staff understands what it is, what you're trying to accomplish. And that goes back to, creating that sense of meaning, like this is meaningful work and it really serves a greater good. And that's something that you can convey through your mission statement to your staff. And then just considering, how your team communicates with each other and how you communicate with your team. Just trying to develop, again, going back to that survey of why nurses stay in their direct patient roles is a positive and engaging work environment. So best way to achieve that is just looking at how the communication happens among the team and among your staff, and trying to maintain, a positive communication style. And, that is something that I think pretty much anybody has room for improvement across the board. So I think some other reduction practices to consider, are the work-life balance methods, self-scheduling or flex hours, if it's even possible to figure out a way to implement those sorts of things that could really help people with their work-life balance. Having a well-defined plan during staff shortages, it seems to be a big issue for people. So at least if your staff knows, what to expect and how you're going to manage staff shortages, I'm sure that would have a positive impact on them. And cultivating a positive work environment by understanding the needs of your staff. And, just again, goes back to developing an open and positive communication style, and offering, getting some feedback from your staff on what they need. These days, body, mind, spirit, self-care, self-awareness programs are becoming more and more prevalent because people find them very helpful. So if your staff has an interest and if that's something you can implement for them, I'm sure that would be a huge factor for them. And then, any mental health resources that you offer your staff, I mean, certainly, encourage the use and make sure that they're aware of what's available to them. Some other things, just doing a little bit of research on what employees, really like, what helps morale. If you can do some healthy food, snacks, or drinks for your staff, I'm sure that they would love that. Everybody loves that. Swag and giveaways is another thing that they love. And, a little newsletter, just doing staff recognition and bonding, is something that I think employees appreciate and can get involved in. That's a nice thing to do on a regular basis, giving staff some recognition. Birthday celebrations and special events. Special events are great because you can even do training, at cross training, and that helps your staff, that helps you, it helps the patients. So there's, just some more things to think about that maybe you could implement. One or two or three of these things could really make a change in the morale and retention of your existing staff. So, and this is kind of the final piece of turnover reduction practices to consider. And this is a topic that can be a little tricky and a little difficult to talk about because it's not pleasant, but anybody dealing with direct patient care, might have negative interactions with patients. So it's important for your staff to know that, you're aware of the situation and are taking steps to address it. And that also goes back to that nurse survey where they want to feel healthy and safe at work. So if staff is having if you have clear boundaries that you can set with patients and reinforce that through, whatever material you give your patients, spell it out very clearly, that really helps your staff understand that, you're talking to the patients about this to the best you can. Obviously not every patient's going to be fully, in charge of their faculties to understand what you're telling them, but the ones that are, coherent, it's important that they understand that there are boundaries that you need them to adhere to. And then, talking to your staff about self-awareness education, counseling, and even security training. And the self-awareness piece of that, I think, is really key, because that would really help your staff deal with their own reactions, because you can't control every situation. But if your staff has some, sort of education on how they react to negative situations, that could really help them deal with those situations in a much more positive and calm manner. So that's it as far as my turnover reduction practices. And as far as some other areas that we can look at just as a whole, as the healthcare system as a whole, to take the strain off of our system as we deal with this inequity in workforce and care needs. Obviously, there's local, elder services. It's, if you can't take on a patient, but you can send them to a local, elder services, municipal elder services place. I mean, I'm sure that they would really appreciate any resources that you can offer. I know Mass Department of Elder Affairs has resources as well. Religious and nonprofit organizations in your area are a great resource. And one thing I'm excited about is technology, and working with patients who, they may be working with a local IT company to develop a plan or refer patients to them to get, there's all sorts of things you can do with technology as far as sensors in the home, video cameras. So elders who want to stay in their homes can be looked after and monitored and kept safe, through technology. So I think that's exciting. So that might be one of the ways that we can really, solve the problem. And then there's also legislation in place. I think every year Title VII and Title VIII programs, provide funds to develop the healthcare workforce. And then there's also the Workforce Resilience Act to allow more visas for foreign-born nurses. And there's always an allotment of those anyway, but they're trying to increase it because the nurse shortage is so significant. So that's just a couple of things that we look at, to see how we can, affect this healthcare, strain. So in conclusion, I just think, again, the aging population and the patient dynamics are, kind of moving existing staff out of the healthcare field. And, while our pool of available workers is shrinking. So keeping that, supportive and positive team with a clear mission is key to really retaining patient care and profitability. We can, look to new models to hire and retain staff, and partnering with colleges, nonprofits, government, IT will give us ideas and support for dealing with our healthcare shortages. And then I also found some resources through the state where you can actually apply for grants as well to deal with your staffing, to help fund some of your staffing needs. So that is basically the resources and ideas that I wanted to present today. Does anyone have any questions? No? Okay. Well, thank you very much. I really appreciate everybody's time. Thank you.
I'm gonna unmute myself for a second. That was great, and it is an excellent time to be entering this industry. And I think a few people on the call are new and probably getting their feet wet and learning about the various complications with staffing and knowing how to up staff for the coming demand, but not so much so that it diminishes your reserves for sure. So thank you guys, and I'll send out this recording to everyone who has registered for the program. So you'll get a recording link, and I'll send the contact information for our speakers to everyone, and my contact information is there as well. So as you enter this and have questions along the way, don't hesitate to reach out. Thank you again, Rachel.